back. Are we ready in the front, Jane?
Yes.
Okay, and are we ready up to the public? Okay. All right, well, good morning. Today is Wednesday, October 11th, 2023, and we'd like to welcome everyone to the board meeting. We'll call this meeting to order at 9 a.m. You can join today's board meeting via phone. Dial 971-254-3149. Conference ID 736-023-979#. Audio capabilities are listen only and offered on the best effort for the public. Our meetings are also live streamed, and you can join us by going online to tctvonline.com and click on live broadcasts. Before we get started, I'd like to remind everyone to mute their phone. You can do this by pressing *6. Please unmute your phone when your agenda item is ready to be discussed. For those joining via computer, please unmute your microphone and turn on your camera when your agenda item is called. All others must remain muted with their cameras turned off. Thank you. Public comment. Those intending to provide public comment to the board may attend in person or email submissions to publiccomments@co.tillamook.or.us. Public comments received by 12 p.m. on Tuesday will be distributed to the board, posted online before the meeting, and become part of the public record. You may also provide public comment virtually by registering ahead of time. To register, please email publiccomments@co.tillamook.or.us by 12 p.m. on the Tuesday prior to board meeting. Public comments can also be emailed to the Board of Commissioners office, 201 Laurel Avenue, Tillamook, Oregon, 97141. For more information on public comment options, please visit the Board of Commissioners webpage. Do we have anyone signed up in the room, or has anyone registered online for public comment?
No, neither.
Okay, no public comment today. All right, we have already called the meeting to order, so I would like to welcome everyone in the room and invite them to sign the guest list if they've not yet had a chance to do that. And we will begin our meeting with the Pledge of Allegiance. Commissioner Yamamoto, would you lead us? Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, we do not have any non-agenda items today, so we will launch right into our legislative administrative agenda with item 5. Discussion and consideration of a pharmacy agreement with Genoa Healthcare LLC to provide pharmacy products to covered individuals. Marlene Putnam, Administrator, Health and Human Services. Marlene, are you with us?
Not yet.
Not yet. Perhaps we're just moving way too fast this morning. Or perhaps she's sitting in her car also hoping that the rain will stop. Or at least let up. I can carry that, but why don't we go ahead and actually she has the first 2, 3.
Should we just come back to her?
I'm going to suggest we'll give her a few more minutes. If she doesn't make it, I think that I can carry those if we need to.
Sure.
Okay, but I was not expecting to. So we will go ahead then, and for the moment, we will postpone item 5, 6, and 7 to later in the meeting, and we will move on to discussion and consideration. For item 8, discussion and consideration of a lease agreement with Anduril Industries, Inc. for a Marine Sentry Tower Deployment Test Site. And I see we have Joanne Wolfley, Director of Parks, in the room with us, along with Kevin Tucker, the President of Near Space Corporation. Good morning.
Perfect timing. You guys are right on time.
Good morning. Rowan County Parks is pleased to see, or asking to see if we could have a lease with Anduril and Near Space out at Barview for a project that they're doing. And I'm going to let Kevin go ahead and say.
So we reviewed this with yourselves at a prior meeting. The essential project is Near Space Corporation is a local company operating a test range under FAA authority. Anduril is a corporation located out of California. They want to test a marine search radar system. They've identified this area as being a very optimal location, and we have a working relationship between the two companies. Anduril Industries would establish a lease for a small parcel that was identified as an optimal location. It's, as Joanna said, out at Barview just on the ocean side of the current Coast Guard observation tower. So a small piece of land where they can set up an autonomous system for the purposes of test. Near Space, having an agreement with Anduril, would be the local support. So we would provide all the installation support with them, training. Our team would be able to site visit weekly for preventative and check maintenance and respond if anything happens. This is a coastal search radar system, so it's able to identify targets out to the horizon and then look at them with very detailed cameras, and then also connect that with the shipboard AIS systems to get a complete situational picture. Coast Guard has been talked to. They're just fine with having it set up right in front of their location. They would also be very interested in having access to the radar data, which Anduril said they can, understanding it's a test system and not an operational. But they would be able to use it, which they were very interested in doing, and being able to watch bar conditions, look out, see targets at night, identify vessels, etc. So it gave them operational capability. As a result of the last review meeting, we needed to finalize a lease agreement between Anduril and the county, which has been done. And the subject of today's discussion is if that's fine with, from county's review standpoint, for the commissioners to sign it. Once that's done, the property will be available. We'll coordinate with Anduril for the final installation setups and get this moving.
Okay, thank you. Questions, commissioners?
I don't have questions. I'm glad this is moving forward. I thought it was fascinating when you talked to us about it before, and I'm pleased that the Coast Guard will have the access to the data, and I think it's a great partnership, and I'm glad we can participate.
Perfect, thank you, Commissioner.
Kevin, I would concur with that. You know, you're one of the unsung great companies that reside here in Tillamook County. And I'm not sure that everyone in Tillamook County understands exactly what you do. And I think there are things maybe that are better not disclosed, that you do some pretty high-tech things in this county. But I, for one, appreciate very much you being in Tillamook County and doing what you do. You provide access for emergency management services for Tillamook County, not if, but when the Cascadia subduction zone should hit. Again, where you are at the airport, at the Port of Tillamook Bay, you're going to be this is going to be one of the only operational airports on the Oregon coast. So your drone capabilities and things of that nature are just unbelievable. They really are. So we appreciate everything that you do, and I'm hoping that this lease agreement works out well for you and brings even more high-tech things that I don't understand in Tillamook County. And I think that would be great. So I'm in full support here.
Perfect, thank you, as am I. I think this is it's a great opportunity for obviously the Coast Guard to get that information, but also to have a system like this that gets tested in our county. We love to be the pilot. We love to, have things tried out here and proven if they can be. So I think it's a great opportunity. I know that it didn't make it into the lease, and that our assessment department was concerned and that you get the information that, of course, this is a taxable account that will be created related to the property, and there will be a tax bill. So am I representing that correctly? Yeah, so that it wasn't part of the lease, but it is just part of general practice and making sure that you all were aware of that. Not surprised when a tax bill arrived.
Okay, and would that go to Anduril or us? We can handle it either way, or we'll figure that one out later. We can take that for later.
I'm guessing because it's not in the lease, and we, in conferring with council, decided to forego that just because of how long it took to get to here. So because we are I'm guessing that the statement would come to us and we would pass it on to you.
Okay,
Yeah.
that's fine.
Not expecting a huge bill with a 15 by 15 spot, but just an awareness so that you all are not surprised when you do get that.
Thank you, Commissioner.
Yes. Okay. No, I think this is great. I think we're ready for a motion.
Madam Chair, in consideration of a lease agreement with Anduril Industries, Inc. for the Marine Sentry Tower Deployment Test Site, I would move approval.
I second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Thank you
Thank
both
you.
for being here.
Thanks so much.
And I do see that Marlene has joined us, so we are going to circle back in our agenda to item number 5. and with discussion and consideration of a pharmacy agreement with Genoa Healthcare LLC to provide pharmacy products to covered individuals. Marlene Putman, Administrator, Health and Human Services. Good morning, Marlene.
Good morning.
Good morning. My apologies. We have all staff meetings on Wednesday, and we were actually following up on the Gallup survey results and doing a facilitated discussion with our staff breakout teams, and just went a little bit over in my follow-up, so my apologies for arriving late. I am excited to talk about this item today regarding the pharmacy agreement with Genoa Healthcare LLC. We began conversations with this company shortly after the closure of Tillamook Pharmacy and concerns expressed by our patients and community members. How can we connect folks with pharmacy services either by mail or in person, and support people in medication management as well? So this agreement with Genoa describes our intent to begin working on two things. One is assisting people and giving them an option for other ways to get mail order information and what are called pill packets. So sometimes you'll see people who have a little box that says Monday through Sunday with multiple little, containers in there saying what their pills are supposed to be for each day. The pill packet process basically sets those up ahead of time for people and sends them in the mail that way. So if they have to take a pill in the morning and like when they get up, and then in the mid-morning, and then at lunch, in the afternoon and evening, they're set up that way so they can just take them, easily open them. So that's one option that's available via mail, but other prescriptions as well. So giving people another option if they're not happy with the choices that they have now, or they want to try something different. We would be partnering and are partnering with Genoa to send that information out to our patients in particular, and other people could choose that option as well. And then secondly, we are working with Genoa to discuss an on-site pharmacy for our patients and others to be determined, to make sure that folks can pick up their medications and have consultation with the pharmacist or care coordinator about how to take their medications, when to take their medications, and what kinds of issues they should call about if they have a concern. So the process for the second component of actually creating an additional pharmacy takes a little bit more time, as well as some further investigation. So we are expecting to have an on-site visit the end of October with folks from Genoa to talk about sites and how that might come about, whether it could actually be on-site or on a site near us with short walking distance, because the best way to operate is to have it accessible right after someone gets their healthcare visit, or meeting with their provider, behavioral health clinician, etc. So we're kind of we would be in that process after signing this agreement to look at siting, which could take then thereafter, again, assuming we all agree on it, could take 6 to 8 months if we have to construct or remodel or do something like that for a facility. So how does this work, and how could we possibly do this with what we currently have going on? So Genoa operates the pharmacy, sets up the pharmacy, handles the billing for the pharmacy, hires the staff for the pharmacy, looking to local resources to do that. They then work with our team on consultation with patients, sharing patient information where authorized, and education for both the providers and the patients about which medications would be appropriate for a particular patient, or consulting about some things if there are issues with medications. So we are not putting out funds in this partnership. We are partnering for a pharmacy to join us, and they would then create that role, that facility and the services. Part of this agreement that you have before you also anticipates sharing of electronic medical record information only for those patients that choose this pharmacy. So patients would be notified, you would have the appropriate, agreements in place so that HIPAA for health Information Portability and Accountability Act is protected for those folks. So this is the beginning stages, but we're excited to begin the process and hope that it will move along quickly. I've checked on the reputation of Genoa. They were a reference or referral from Columbia Pacific CCO. I've talked with a number of other counties who have implemented or work or partnered with Genoa. If you look on their website, you'll see that their big focus really is around behavioral health and substance use disorder communities initially, which we do have the highest number of MAT patients in the county served through our organization, but we also have behavioral health services. And they provide medication for people with chronic health conditions or co-occurring disorders. They have since expanded to work with and continue to work with federally qualified health centers or community health centers like us. So this is kind of their area of expertise with over 20 years of experience. They have a clinic in Astoria and one just over the hill near Portland and in Clackamas County. So there's a local contact as well. I could probably provide more, but that's an overview of where we are at and hoping to move with this resource. So happy to answer any questions as you consider this pharmacy agreement.
Perfect. Thank you, Marlene. Appreciate that. Questions and comments, Commissioner?
I think this is wonderful. Thank you for your work on this. Since Tillamook Pharmacy went out of business, our community has experienced difficulty getting their prescriptions filled. We have other pharmacies in the community, but everybody is short-staffed. And so we've heard from people that they're having trouble getting their prescriptions, they're having trouble getting them in a timely way. And it's interesting to see how the lack of workers impacts nearly everything in the community. It shows up time after time after time that the lack of workers is impacting the ability to do business. And so I think this is a great option for the patients of the health department, for the community. I think it's terrific. And I'm particularly pleased to hear you talk about the daily pill packs, because I have never heard of that before. And it is a great idea. It's very, it's heartening to me because I think somebody's not muted. There we go. When in the last couple of years of my mom's life, she was on a lot of medication, and I think that's true for a number of elderly folks. And at one point she said to me, I can't handle my pills. I can't do it anymore. I can't fill my pill boxes. And she kind of made a joke about it. Pills and bills. I need some help. So I would go to her house a couple times a month and fill up all of her pill boxes and, do her bills. And that's fine, but it would have been, not everybody has that. Not everybody has a family member who can come over and work through that stuff. And it is complicated if somebody's on a lot of medications. And it would have been empowering for her to be able to just order it online and have it delivered and not have to ask for it. So I'm very encouraged that is available, and I fully support this agreement.
Perfect.
Marlene, this is really exciting news, and it's happening very quickly. I'm absolutely amazed that you've been able to put a package like this together to start the conversations with the company. I'm glad to hear that it's possible we may be able to provide the service to other than health department patients. I am a health department patient, so really it's good for me, but for others that are not patients of the health department, I think this is a great opportunity. There is a lack of pharmacy services in this county, especially all the people, and I was one of them, that went to Tillamook Pharmacy in the past. So I think the options, the potential options here are terrific. I know it's going to take some time, but I hope you can put this together, and I am in full support here.
Perfect. Thank you. Yeah, and I agree. This is a much needed service in our community, and as soon as the notice came out about Tillamook Pharmacy, I started receiving calls from concerned citizens about what would happen. So I appreciate as well, Marlene, the speed with which you are working on this. I know for people who are struggling for their prescriptions, it will feel not fast enough because they're struggling, but this really is a great solution that doesn't require the establishment of a brand new pharmacy, which is just not something that I think we have a local provider to do. But by bringing in a pharmacy that is already certified, already has everything it needs, we just need to provide an appropriate and adequate location for them. So I think getting into this conversation sooner rather than later is very, very important for our patients at the health center, but also for our community, particularly in light of the merger of Kroger and Albertsons, which is Fred Meyer and Safeway, and the unknowns that are coming with that, since those are our two chain level pharmacies at this time, and we're not quite sure what the impact will be. And so I think getting something on the ground is really important. We do have the Nehalem Bay Health Center and Pharmacy that is available to folks as well in North County, and you can get your prescriptions there even if you're not from North County. But I think for people it's a bit of a drive, and having something here locally is going to be really important. So thank you for this, and I think we're ready to sign the agreement and get it going.
Ready for a motion, Madam Chair. Oh, go back to number 5. Madam Chair, in consideration of a pharmacy agreement with Genoa Healthcare LLC to provide pharmacy products to covered individuals, I would move approval.
I second.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Moving on to item number 6, discussion and consideration of an agreement with Columbia Pacific Coordinated Care Organization for traditional health worker primary care expansion. Marlene Putman.
Yes, so this to me is another exciting opportunity to support folks in our community by providing some community health workers to work in the field. They'll be based in our clinical care, but we will deploy them out to work with patients and our community. So this is an agreement, as indicated, with Columbia Pacific Coordinated Care Organization to provide $200,000 for our department to implement community health workers in the clinical setting, one for medical and one for behavioral health. We already have one community health worker working in public health, and this would allow us to be part of the Columbia Pacific CCO Primary Care Expansion Program to add these 2 additional health workers. The page 2 describes what we agreed to do, and the page 1 says the purpose of this, which the intended population are Columbia Pacific CCO members, so folks who are on Medicaid who are needed of advocacy and assistance in navigating their physical, behavioral, and or social health needs. Typically, when we provide care coordinators, as we have now, we provide those for all patients. The focus of these particular positions are for Medicaid members, but we would also extend the services to the rest of our patients as needed. The reporting will be about the specific population served by Columbia Pacific, and it is for a 1-year term. It starts September 1 because that's when I began discussing this with them, and then it will end August 31st of 2024. We are also working, as I mentioned previously, with the Nestucca Valley School District, which we hope that they will get a separate $100,000 for that particular position. So there'll be $300,000 coming into Tillamook County to place these community-based traditional health workers, or as we call them on our side, community health workers. So we're looking forward to that. We have updated some descriptions for these positions and are working with HR, which we really appreciate their involvement. So this is for you to consider whether you want us to go ahead and implement these with the funding from Columbia Pacific.
Perfect. Thank you. Are there questions or comments, commissioners?
I am fully supportive. I think it's a great opportunity and a great partnership with Columbia Pacific, and I'm hopeful for the Nestucca Valley healthcare worker.
Marlene, this is great work. By definition, CPCCO members are an underserved population. And so these coordinators, I'll just call them coordinators, are going to be extremely helpful in making sure that they're getting the best health care that they can receive. And we already do a great job in Tillamook County. No, you do a great job for Tillamook County. You really do. But this is just going to assist you in making sure that the best possible care is provided to everyone in the county. And I am in full support here.
Perfect, thank you, as am I. I think the use of community health workers it's akin to the work to peers that we're seeing in other sectors. It's really recognizing that sometimes what someone needs in addition to a doctor and a nurse is someone to walk alongside them through the process, to help them understand who they should call when, where they should go, what they need to ask, the types of things that sometimes people are intimidated to talk to their medical provider about these things. They're just something about talking to their doctor or their nurse just puts them a little off and they're afraid to ask. And these traditional health workers are just so much more approachable and really do walk alongside patients. So I'm super excited to have this expanding in our clinics. I think it really does make a difference for people getting the health care they need. So Columbia Pacific CCO is a great partner and really is committed as well to folks getting the health care they need. So thank you, Marlene, for starting that conversation and engaging and adding to the service for our patients. I think we are ready for a motion.
Madam Chair, on consideration of an agreement with Columbia Pacific Coordinated Care Organization for traditional health worker primary care expansion, I would move approval.
I second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for a vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Okay, moving on to item number 7. Discussion and consideration of amendment number 2 to Oregon Health Authority 2023-2025 Intergovernmental Agreement number 180028 for the financing of public health services. Marlene Petman.
Yes, you may recall when we talked about the First Amendment that there was likely going to be a second family to add some of the funds that were not in the original biennial budget for 2023 through 2025. So this agreement is effective July 1 of 2023 and runs through June 30 of 2024, the first year of the biennium. So you'll see amendments throughout this 2-year period that reference the same agreement. Specifically, this relates to page 31, Exhibit B, that details the increase in the budget items, which there's 3, so I can run through them so you don't have to plow through all the paper. But the first one is Program Element 1, the state support or general fund, if you will, for public health services, which is $26,488.25. And Program Element 12-1, Emergency Preparedness and Response, for $53,079. And then PE 51-01, which is Leadership, Governance, and Program Implementation, or what we refer to often as Public Health Modernization, which had an additional appropriation during the last legislative session and then was appropriated for 23-25. And that totals $305,017.56 for a grand total of $384,584.61. So those were the increases that were added to the amendment. There are some specific items related to Program Element 1 for, some detail around some footnotes if you want to pay attention to those details. But legal has reviewed this. There aren't any other significant substantive changes in terms of responsibilities. This is the funding to address the program elements that we're required to address under Oregon Health Authority rules.
Perfect, thank you. Questions or comments, commissioners?
I do not. I'm fully supportive.
Okay.
As am I. This is the second amendment. It's October, so I think we're doing pretty well this year, this fiscal year so far. We're only up to our second amendment. I'm in full support.
Perfect. I'm sure there are more to come, as there always are. So, all right, I think we're ready for a motion.
Madam Chair, in consideration of amendment number 2 to Oregon Health Authority 2023-2025 Intergovernmental Agreement number 180028 for the financing of public health services, I would move approval.
I second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you,
Thanks,
Marlene.
Marlene.
Thank you. We'll keep you updated on what's going on with the pharmacy and our community health workers.
Great.
Perfect, thank you. Okay, for anyone just joining us online, we have already taken item number 8. We switched the order. So we are moving on now to item number 9. Discussion and consideration of amendment number 2 to agreement number 6229 with Yamhill County for the housing of juvenile offenders. And we have Matt Fennell, our director of the juvenile department. Good morning, Matt.
Good morning, Commissioners.
Good morning, Matt.
What you've got in front of you is a proposed amendment to our current contract with Yamhill County. They are our primary detention provider. I attended a meeting with them and some other partner neighboring counties in early September where everybody was informed that Yamhill County is increasing their costs of using their detention facility. And that's just due to a number of economic factors that, all of us are pretty well aware of. And our current contract status is an as-needed space available arrangement. If they have space, which they've never told us, no, we don't have space, we can use the facility. What they are encouraging and incentivizing their partner counties to do is to move to what's called a guaranteed space contract. As of October 1st, their as-needed daily rate went from $168 a day to $495 a day. And if counties want to enter into a guaranteed space contract, the rate is $180 a day for the remainder of this fiscal year. It will increase each year a little bit. I believe it's I don't know what the percentage increase is. I know that for fiscal year 24-25, for example, will go from 180 to 210 per day for the guaranteed space rate. Obviously, the biggest change here is a fiscal output of the county. We do have an additional detention contract with Marion County, and I've had that in place as just kind of a backup contract, an emergency overflow contract. We've never used that contract. We don't really have a relationship to speak of with Marion County. We have an excellent relationship with Yamhill County, and my 2 cents here is that relationships are worth some money. I can answer questions, and I can offer a little bit of statistical basis for the ask here. Our average daily population in detention from the beginning of 2020 to late September of 23 was 1.19 kids per day. So that's kind of where the ask for a single bed guaranteed contract comes from. And Yamhill County had for many years, I think about 20 odd years, had their daily rate at $148 a day, and they bumped it for the first time, I believe in 2022 to $168 a day. Also, the overuse, if you happen to be a guaranteed bed contract holder, is a lesser rate for overflow. It'll be $148 a day, which is an old rate. Anyway, I'm happy to answer questions if I've left anything out. But this is for your consideration and approval, hopefully.
Thank you, Matt. Questions and concerns, commissioners?
Well, it's interesting. Of course, we never want to pay more.
No.
But the cost of doing business goes up. And I recall that we had for years a contract with Lincoln County, and that's not available. So I trust your judgment. I wish we weren't going to have to pay more for that, but I trust your judgment. I do wonder, you said that we have a backup contract with Marion County. What's the price for that one?
They're going to be sending me a new contract to present to the board, and I believe that they want to renew that for 5 years. And I believe the rate for that is going to be $170 a day. So in a perfect world, I would be able to hopefully use Marion County if we needed to put any kid, if let's say we had a kid housed at Yamhill and we needed to use an additional space, I would like to be able to access Marion County for the lesser rate. And this all started during Yamhill County's budget process, because the county commission there was like, hey, we need to be collecting more of the true cost for the use of this facility. Detention facilities are a money pit, to be quite honest, and they're very expensive to operate because they have staff, they have food, they have supplies, they have medical care, they have contracts with ESDs or school districts to provide educational services, so they're really expensive to operate. And you know, they're getting more and more expensive to use if you're a county that doesn't have your own. But yeah, so the rate that Marion would be having for their upcoming contract, I think it's 160 some a day under the current contract, and they're bumping it to 170. But we've never asked them. This is just an anecdote, but one of my counterparts over in Yamhill County had one of their youth picked up and detained it over in Salem, and Salem, Marion County would not even hold on to the kid for the weekend until they could get him Monday morning. So we've never used that contract. That's just an emergency. I think that, I think if we needed to, I could probably make it happen, because I don't really know the folks over in Marion all that well, but I know a few people. So, and then, yeah, I mean, obviously it's a double-edged sword, because we have, on one hand, you have guaranteed access, and then on the other hand, you have possibly a service that's being paid for that's not being utilized. So that's where we are.
And what do you find in terms of your budget impact?
I think for the remainder of this fiscal year, we're covered pretty well budget-wise, assuming this contract gets approved. It would be future. It would be the budgetary ask for future years that may be a question mark. But previously, when we've been using detention on an as-needed basis, our expenditure of our detention line item has been a real moving target, because sometimes we use a bunch of it. And sometimes we don't use very much. Some of our grants, some of our pass-through dollars that come in through the state are allocated for reimbursing some of our detention costs. So that's how those have been set up for a number of years, and I've kept it that way.
Thank you.
So Matt, yeah, I know no one likes to look at increased costs, but this is the cost of doing business. I think Yamhill County has had the rates below what their costs were for a lot of years. Mm-hmm. And I understand why the commissioners have determined that it's time to up rates. Apparently they have a facility large enough to handle contracts from outside Yamhill County, and we appreciate that, because we certainly don't have the funds to develop a detention center for the juveniles in Tillamook County. So this is the cost of doing business. I see Sean Blanchard online. Sean, have you looked at this contract at all? I know Bill has, right?
Yes, I have. I didn't look at the finance.
I understand. I'm not sure that Sean is
There she is.
active. Sean?
Good morning, Commissioners. I have, and I've had a chance to talk with Matt
Perfect.
about it and how it's going to affect his budget going forward.
Perfect, yeah. I mean, again, it's not something we want to do, but we have to have these contracts in place. We do. When we have kids, unfortunately, that need to be in detention, we have to have a place to put them. So having a primary contract with Yamhill, having a secondary overflow contract with Marion really does make a lot of sense. And having the guaranteed one, you've run the numbers since 2020. So I think you're doing all the right research and everything you need to do. I would be in full support here.
And for whatever it's worth, there is a discussion that just started, us and some neighboring counties that use Yamhill. We are trying to get into place like a mutual aid agreement to, like, if one county needs an additional bed and another county's not using one of theirs, then the other county could use like a bed sharing if somebody needs overfill without any additional cost. So I don't know where that will go, but we have had one meeting about that, and I think Washington County could be the big question mark there, because at the day we had that meeting, Washington County had 21 kids in detention between Donald E. Long and Yamhill County.
Wow.
So,
We hope we never get there.
Right, right. All right, thank you. No, I think this, agreed, none of us want to see costs go up, but we know for our own budget that we are increasing our fees in order to continue to be able to provide our services in our community. And it only makes sense that Yamhill is in a position where they have to do the same. Counties' costs have outpaced our increases in property taxes and put us across the state, put counties in a bind to continue to maintain mandated services when we don't have the opportunity of increasing our tax rate. And we don't want to tax our folks more, but fees direct it right to where the usage occurs. So this is one of those pieces, and I'm pleased to hear that you have within contracts or grants from the state some of the cost of this covered. I think that's exceptionally helpful, but we have to have a place for them to go. And in reading the contract and recognizing that in fact, they can choose to ask us to remove our person with very little notice should the capacity be needed. And so we have the one guaranteed bed, but if we are in that overfull bed, there's no guarantee we can keep it. So having that Marion County contract as a backup is just really important. We need to make sure that we're covered with the services needed by the kids that you're working with, so.
I have something else I'd like to talk to Matt about, not on this subject, so would you like me to do it now or after the vote?
Why don't we take the vote and then go from there? So.
You're on the hot seat, man.
Okay.
Go, it's coming at you.
Madam Chair, in consideration of Amendment Number 2 to Agreement Number 6229 with Yamhill County for the housing of juvenile offenders, I would move approval.
I second.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries.
So, Matt, your staff is at the Substance Abuse Symposium,
Substance Use Disorder Summit.
Disorder
SUDS.
Summit, thank you.
CPCCO.
In Seaside, and when we heard from, a couple of us heard from Garrett Knopfinger how much he's gotten out of it, how great the
It's called the Summit.
how great the summit is. And specifically, he was reaching out to ask, what would it take for Tillamook County to start a youth council? Because apparently, there's a youth council at the summit, and they were really favorably impressed with the youth participation in the Substance Abuse Disorder Summit. And so Garrett reached out to me. I believe he reached out to Aaron as well, and I suggested he start looking at models for where else is this done successfully and what does it look like. And so he started talking to people about it, and I'm really impressed with his initiative, and his enthusiasm was genuine. And so two things. One, I'm very much interested in a youth council. And two, I thought if your staff, when they come back, if they'd like to make a presentation to us in this meeting so that it could be shared with the community about what they learned at that summit, I would love to hear that.
okay. I will definitely follow up on that. I think I would want to know more about the youth councils, because I've heard of youth courts and stuff, and peer courts and stuff like that. I'm not exactly sure what a youth council does. I don't know if it's I feel like I should know what that is, be able to talk about that a little bit, and I can't right at the moment.
That's
so,
okay, I totally put you on the spot,
no,
but it's
that's
not
fine.
a court. My understanding is that it's not a court, it's a chance for a group of young people to be able to weigh in on issues that officials are considering.
Okay,
To be able to say, this is how this impacts us as young people.
okay. I think that's a good idea.
Perfect.
Okay.
Yeah, and I requested a little more information as well, because I'm wondering if it is specific to substance use disorder, if it might be a good partnership with our Tillamook, or if it's on broader topics, just figuring out kind of where it best fits. So we'll look forward to future conversations.
Absolutely.
And well done from your staff.
Okay, thank you.
You're welcome.
Thank you, ma'am.
Okay, thank you, Matt.
Thank you.
Okay, we will move on to item number 10, discussion and consideration of a master intergovernmental cooperative purchasing agreement with National Intergovernmental Purchasing Alliance Company, DBA Omnia Partners. Isabel Gilda, Executive
Thank you,
Assistant Board
Commissioner.
Commissioners.
Good
morning, Isabel.
Good morning. As you mentioned, this is the Master Intergovernmental Cooperative Purchasing Agreement. We originally entered into this agreement in 2014, so the agreement today is essentially just a renewal to update our county contact information. There's no subscription costs or costs associated with this, it's strictly a renewal.
Okay, perfect, thank you. Questions or comments?
For people who are watching, Isabel, what kinds of things do we use this for?
So cooperative purchasing agreements allow state and local governments to purchase services and goods and provides access to existing group purchasing contracts, and that assists us in our procurement solicitation process. So it just gives us essentially greater buying power.
Wonderful, thank you.
Yeah, they're called piggyback agreements. So they've gone through the process of being bid out and lowest bidders, and we're able to enter into contracts with the folks who, won those bids at the same price as essentially.
And it also saves staff time for the solicitation process.
Right, we don't have to do our own RFPs for any of these things because it's already on the list. Yeah, perfect.
I know this isn't a perfect analogy, but it's kind of like a Costco for government, right? Rachel's kind of smirking at
Maybe
me.
not.
Maybe
Not
not.
exactly.
Maybe not, but that's
Not
okay.
exactly. Someone else just did the work for
But-
us to find the lowest
There
bidder.
you go, okay.
Yes,
perfect.
and then they agreed to let us use their price.
Perfect.
Okay,
I'm still in agreement.
okay, good. We'll move on. I think we are ready for a motion.
Madam Chair, in consideration of a master intergovernmental cooperative purchasing agreement with National Intergovernmental Purchasing Alliance Company, DBA Omnia Partners, I would move approval.
I second.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you, Isabel. Oh, you're still with us.
Oh, another one.
Discussion and consideration of the Association of Oregon Counties Conference Product Tasting Donation Request Letters to Tillamook County Creamery Association, Werner Meats, Pelican Brewery, and Blue Heron French Cheese Company. Isabel Gilda.
Thank you. It's that time of year again. We're in November. The commissioners will attend the Association of Oregon Counties Conference. It's an annual event, and at this, at the end of the conference each year, they hold a product tasting event, and it's where every county that participates brings products from their counties and promotes their companies. And today we're asking for permission to send the donation request letters to the Pelican, who have always been extremely supportive. Werner Gourmet Meats, everybody loves the jerky, and of course Tillamook Creamery, we are famous for our cheese, and the Blue Heron. So we've been very fortunate. We've been doing this event for, I don't know, maybe 15 years, and we're very lucky to have such supportive partners.
Perfect, thank you. Commissioners, questions or comments?
I am happy to ask that our community business partners to participate in this with us again. Every year, it's a source of pride for us to be able to share Tillamook County products with people from around the state. And as you mentioned, there are tasting tables from almost all the counties.
Yeah.
And I think, I'm biased, but I think ours is the best, and it's very, very popular with
It is
everybody.
very
So it's
Yeah.
it's really fun to be able to share these excellent products with our fellow commissioners and staff from other counties, and it's good exposure for the businesses. And personally, I have purchased things from other counties that I learned about at that event, and so I imagine that other people are purchasing things from our businesses that they learned about at the event. So it's good for everybody.
That's a big part of it, is the promotion
Yeah.
of the
Yeah.
companies.
Absolutely.
So every year at ALC's annual conference in November in Eugene, we do a product tasting from all the various counties. And this is just a great, fun way to end 3 days of conference. That's for some of us 4 days of conference.
That's right.
It's just a great way to end. It's just a fun time. It's a lot of work. And Isabel, you and Deb have been instrumental in helping us put all this together. But ours is one of the highlight booths, I think, of the Taste of Oregon. And it showcases what each county does so well. And Tillamook County has so much to be proud of. So with the Creamery, with Warner Meats, with Pelican Brewery, and with Blue Heron, I mean, this is all great stuff, it really is. We appreciate the donations. The county unfortunately can't afford these things. But the great supporting companies that we have in Tillamook always go above and beyond. And we do appreciate that so much.
They do, they've been very generous.
They have been. Over the years, they've been so generous. And we want to thank them even before they say yes to this year's donation.
Absolutely. Okay, perfect. As am I. I think this is wonderful. And I know we kind of rotate sometimes and ask different businesses and highlight different pieces from Tillamook County. So I'm excited to hear who we are hoping to highlight this year and look forward to that partnership with our businesses. So I think we are ready for a motion.
Madam Chair, in consideration of the Association of Oregon Counties Conference product tasting donation request letters to Tillamook County Creamery Association, Warner Meats, Pelican Brewery, and Blue Heron French Cheese Company, I would move approval.
I second.
We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries.
Thank you.
Thank you,
Thank you,
Isabel.
Isabel.
Okay, moving on to item 12, discussion and consideration of an order in the matter of amending Board Order Number 23-060, appointing and reappointing members to the Tillamook County Board of Property Value Appeals Board. William K. Sargent, County Counsel.
About 3 weeks ago, you passed an order that appointed and reappointed members to the Board of Property Tax Appeals, which I think has a new name now, but I can't remember what it was. Those being Lloyd Seeley, Gary Knowlton, and Steph Poppy. Well, working with Christie, we got 1 out of 3 right. We appointed Mr. Seeley to a 1-year term, but for some reason, we messed up a little bit and appointed Mr. Knowlton and Ms. Poppy to 2-year terms. This order amends that, so it's correct. Caitlin caught the error. This order amends the prior order so that Ms. Poppy and Mr. Knowlton serve 1-year terms. That's supposed to be in accordance with statute.
Okay, thank you. Questions or comments? No.
Our error, so let's fix it.
It was Christie Meyer.
Bill's error. Thanks to Caitlin for her sharp eye and picking that up. That's why teamwork is so important.
Yeah, and she, you talk about going to conferences. She had gone to some conference where the AG or somebody was presenting, and that was the reason that she became aware of it. So
Interesting.
she picked it up that way.
Perfect.
So it's important. Statutes change.
Yes.
And there are a lot of them to keep up on.
As a matter of fact, ironically, the statute has changed to make it a 2-year term. So next year there'll be 2 2-year terms.
Oh my God.
Yes.
We jumped it.
We were just ahead of the curve.
We are. We're ahead of everyone else.
Right, we are so ready for change. Look at us just embracing change here at Tillamook County. All right, thank you. I think we are ready for
Ready
a
for a
motion.
motion. Madam Chair, in consideration of an order in the matter of amending Board Order Number 23-060, appointing and reappointing members to the Tillamook County Board of Property Value Appeals Board, this being Board Order Number 23-067, I would move approval.
A second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Thank you. Okay, item number 13, discussion and consideration of a transient lodging tax TLT for destination management grant agreement number 2023-P1 for the Tillamook County Pioneer Museum Organizational Capacity Project. Rachel Haggerty, Chief of Staff.
Good morning. This is the second fiscal year where the board has elected to allocate transient lodging tax to specific entities with a standing amount annually, so they can have more security in their financial, in their budgets. This year, as last year, we're providing the Tillamook County Pioneer Museum with $250,000, expiring at the end of June next year. This year, their scope of work proposes to use the funding towards staff, programmatic supplies, their collections reconciliation project, Kiltris Point Reserve, rotating exhibits at the museum, and anticipating some costs that will come out of the facilities condition assessment. I just ready for your consideration.
Okay, questions or comments?
I am fully supportive. I like the system that we set up whereby the organizations, the Tillamook County Pioneer Museum and the Tillamook County Fair get regular support, regular TLT support, so that to enable their budgeting process and give them some financial stability. So I like the process, and I appreciate that they are working with Rachel to let us know what their plans are and how it'll be spent. Perfect, thank you.
And I completely concur here. Our transit lodging tax dollars are perhaps oversubscribed. I think it may be time for a discussion of raising the transient lodging tax.
You're here.
I'm getting a little ahead of myself, but I just want to put that out there. Other counties, Hood River County, many others have substantially raised their TLTs. Let's do the same. We need to remember, transient lodging tax dollars come from those that visit Tillamook County. They don't come from local residents. So I just want to start that discussion. I think it might be time, and so that we can continue the good work that the transient lodging tax dollars do in Tillamook County. So again, I hope I'm not jumping the gun too much, but it is time to have that conversation. Just want to put that out there today. But I'm in full support here for the Pioneer Museum.
Perfect, thank you. We have the short time response beginning.
Yeah.
David's going to start telling us everything that he hopes we will do in his absence. So thank you for that little teaser there. It has been a conversation, to be fair. It has been a conversation and one that I'm sure we will have a lot more of before we would consider moving forward.
Who's the short camera? Okay, understand.
Okay, so yeah, I'm pleased that we have dedicated transient lodging tax dollars as well to the Pioneer Museum and to the fairgrounds on an annual basis. It allows for planning for these organizations that we want to have be effective and efficient. And if they don't know from year to year how they're going to be able to survive and have their dollars, it's really hard to do that. And the Pioneer Museum, I don't know, many people watching know this, some do, but the Pioneer Museum originally had a taxpayer levy back in the, Bill probably remember the 80s. At some point there was a taxpayer levy that was established to provide operating support for the Pioneer Museum. Through the years, that when the tax system got reorganized, that levy got folded into the general county tax levy, which means that the Pioneer Museum lost that dedicated support. And there have been, through this window of time, some dark days where the county commissioners had to make choices between general fund services, including what we've been talking about significantly in the last year, such as law enforcement or the county clerk or tax assessor, and the Pioneer Museum. And at times they have chosen not to fund the Pioneer Museum and have placed that in a position of having to raise its own funds. With the advent of the TLT funds, it gave us a dedicated source of funding that can be used for the Pioneer Museum that allows us to maintain that general fund support to our other mandated services. So there is a relationship with the Pioneer Museum that is and the county, that is very long-standing, and that in my mind says to me that we have a commitment to this organization because the taxpayers made a decision to fund the Pioneer Museum in perpetuity with taxes. And we have changed which taxes, now they are transit lodging tax. But I do think it's important, and I hope that this doesn't get lost again in the future as it has at times in the past, the importance of the county's relationship to the museum. So for that reason, I am exceptionally pleased that we have TLT and that we've committed to provide operational money to them so they can keep going and offering the great things that they do. I'm also on that board and really excited about the work that's happening there. Peyton is our new director. She is getting ready to hire a new collections manager, which was the position she was in previously. We have a new education person, and there's just a lot of good stuff going on. I think we're going to see some real transformations in that museum over the next couple of years. So exciting times. I think we're ready for a motion.
Madam Chair, in consideration of a transient lodging tax TLT for destination management grant agreement number 2023-P1 for the Tillamook County Pioneer Museum Organizational Capacity Project. I would move approval.
I second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. All right, moving on to item number 14, discussion and consideration of addendum number 1 to memorandum of agreement number 4971 with the City of Tillamook, the Port of Tillamook Bay, the Tillamook Bay Flood Improvement Partnership, and the Tillamook Estuaries Partnership for the Southern Flow Corridor Landowner Preferred Alternative Management Plan. Rachel Haggerty.
So the Southern Flow Corridor Landowner Preferred Alternative Project. Yes, we know the name is not the best. It was coined by an engineer working on the project. What evolved over 10 years. It's a 690-acre project area that includes 443 acres of tidal wetland restoration. Easily over 100 partners, funding agencies, the county, the members of this memorandum of agreement, landowners, lots of people got this project to where it was. It included levee removal, setback levee construction, large wood placement, tidal channel construction, and ditch filling, and some structure removals, houses and barns. It was constructed between 2016 and 2017. It was a 2-year summer construction window. At the conclusion of that, part of the project through the construction funding and the land acquisitions was funded by the Oregon Watershed Enhancement Board. As a requirement of that funding, the county who received the funding was required to implement a management plan as well as a memorandum of agreement that guided how the management plan was implemented. So all of the parties that you mentioned when you stated the agenda item are members of this memorandum of agreement that explains the roles and responsibilities of how we are collectively going to implement the management plan. So that management plan was adopted in 2018. We lost a year, it's a 5-year plan, but we kind of lost a year while we were developing it post-construction. It expired in 2022. And so this year, we worked with the partners, the parties to the agreement to update the plan as required by OWEB. So we started that process. Early on in the beginning of the conversation, it came to my attention that OWEB actually allows for documentation in our files and sending to them that if there are no substantive changes that need to be made to the plan, we can just do some documentation and send it to them. So when I met with partners, we all agreed that there wasn't anything major to blow up this revision. It's a very large document. And so we went through and did make a few notes in what the changes were, largely cleanup. It'd been 5 years, and so there were some things like lease agreements, options to sell the Allen property, etc., that we just noted had changed. Talking about moving the website to the TEP, which has been in play for a while, just has not happened yet. We're no longer managing the camera that's out there that's a Cape Mears pointing east toward the project area. It served its purpose, but it's just showing the same thing over and over now. And in talking with our engineer, who also does the modeling with monitoring for flood monitoring, that is of no use to him for that purpose. So, so with that, we have the memo that we'll be sending to OWEB that just captures the changes, and then we have the updated agreement that is before you for consideration. All the other parties have signed, and it's it also just cleans up what the memorandum of agreement originally stated. For all intents and purposes, the roles and responsibilities of who is doing what remains the same. So it's ready for consideration.
Okay, perfect. Thank you. Questions and comments, Commissioner?
I don't have any questions. I want to thank Rachel for your continued work on this. It's an outstanding project and unfortunately.
I would agree with that. It's interesting that this started after the 2006 flood, and Governor Kulongoski established a flood mitigation process. And this project has taken a decade or more to complete. 690 acres. $11+ million, as I recall. And it has had some great results. I am still hoping to see a real comeback of Coho like we have on the Nestucca and the Nehalem, and I think that's going to happen. This has been a great project. I noticed that all the other partners have signed. There are some minor updates to this memorandum of agreement, and I am in full support.
Perfect, and I agree. This has been an amazing project, and I think it's one of the frustrations when we talk about the buyout is that we don't get credit for all of this work that we have been doing over the years to really increase the habitat for our salmon and make this a healthy place, and we don't get credit for that. So this is one of the huge pieces that it is a frustration because we have done good work, and this is a great example of it. So, all right, I think we are ready for a motion.
Madam Chair, consideration of addendum number 1 to memorandum of agreement number 4971 with the City of Tillamook, the Port of Tillamook Bay, the Tillamook Bay Flood Improvement Partnership, and the Tillamook Estuaries Partnership for the Southern Flow Corridor Landowner Preferred Alternative Management Plan. I would move approval.
I second. We have a motion and a second. Is there any further discussion? Hearing none, I will call for the vote. All of those in favor, please signify by saying aye.
Aye.
Aye. Motion carries. Okay, so we are going to move on to, Sarah's raising her hand.
5 minutes.
We need 5 minutes. We are going to recess this board meeting for 5 minutes in order to prepare for the hearing, which was a 10 a.m. time certain, which it is past 10 a.m., so we are good to do that. So we will recess this meeting at 10:06 a.m.